right, y'all, today we're gonna start on the elbow radial ulnar joint. So I'll lay out a circle, we'll go over the lists, functions, and we'll talk about each individual muscle like we always do. So I warned you on Friday that the elbow and radial is similar to the ankle and subtalar, and that it's two separate joints that are combined in one circle because you have a lot of muscles that influence both. They're different apartments in the same apartment complex, the same capsule in the elbow, radial, and joint area. So how you get to read it is the anterior posterior axis is not applicable because your elbow doesn't move in the front plane, right? So in A for AP, the elbow is represented by the bilateral axis. So muscles that cross in the front are going to be flexion polars. Muscles that cross posterior are going to be extension polars, similar to the wrist. Anterior crossing, flexion polars, flexion polars. Posterior crossing, extension polars, extension polars. Okay. The polar axis is our radial ulnar joint. Remember, this is a right, so if it helps you to draw like a little thumb or something as a reference. So this is a right radial ulnar. So pull in this direction is pronation pull. Pull in this direction is supination pull. So pronators and supinators. I think we had precedent at the hip where we had, I call them PE all-stars, but where we go outside for PE and they just want to play on the merry-go-round. Only transverse pullers, and that's what the muscles inside the circle are. Our pronator quadratus and pronator teres and our supinator. So in other words, because they're in the circle and because the bowl is on both fences, they're not anterior, posterior, medial, or lateral. They sit both fences and they're just there to spin. Right? So pronation pullers, supination pullers. Okay, let's look at the muscles that you're going to be accountable for at the elbow and radial ulnar joint. Remember, your abbreviations can be whatever you want them to be. I don't care if, in fact, if you want to, you can write out the names on your circles. The abbreviation just takes up space. It takes up less space. So you can abbreviate them however you want. So you have the brachioradialis, biceps brachii, brachialis, pronator quadratus, pronator teres, supinator, my favorite muscle in the body because of its name, triceps brachii, and comeus. A lot of muscles, brachioradialis is an origin insertion, biceps brachii is in Latin, brachialis is in Latin, but I love the combination of puller and in life when it has pull in the name. To me, they all should be like that. It makes a lot of sense. Crescent, I always love crescent. So biceps brachii here at the elbow is similar to biceps femoris at the knee, both heads, right? Both heads converging into one tendon. When we get into the shoulder, we're going to notice a short head and a long head. And for the biceps and the triceps. But for the elbow, the reason we don't have to be redundant. When we say biceps brachii and we end it like that, that infers both heads. So we don't have to say biceps brachii, long head and short head. We could just say biceps brachii. But when we get off into the shoulder, if there's something that just the long head does, I have to say biceps brachii, long head, or biceps brachii, short head. So you have precedent. Any questions about the layout? It's actually pretty simple because we don't have a medial or lateral crossing. It's just the ones in front. So you're going to have 3 muscles anterior, 2 muscles posterior. You're going to have, in anatomical, you're going to have 2 muscles that pull in pronation. You're going to have 2 muscles that pull in supination. Sorry, you're going to have 3 pronators, 2 supinators. But then the hardest part of this lecture, so distracting. And I understand, it's not you, it's me. I just get distracted with people talking while I'm trying to talk. The hardest part of this lecture is going to be our brachioradialis, which we call the midway muscle. It can be a pronator or a supinator depending on its position. I gave you precedent with the rectus abdominis. I gave you precedent with the piriformis, but this one I'm going to hold you accountable for to be able to figure out, is it on the pronation team or is it on the supination team, depending on the radial joint. Right. First look, all that stuff together is overwhelming. I got that. I don't know. I can't see how that pulls. How that pulled? Maybe not. You know, superficial on top of deep. It's hard to see with all that stuff together. So that's why we split it up one at a time to see how these muscles pull. There's another picture of all these different things happening at the same time. Which ones are in the front? Which ones are in the back? Which ones are pronation pulling, supination pulling, etc. Okay. If you guys remember, for pronation and supination, in anatomical position, we're supine, facing up, facing forward. Pronation is when the radius gets wrapped around the ulna, the act of going prone, the act of going supine. Gonna get to those in due time. All right, first muscle of the elbow and radial joint, the brachialis. The brachial part of the arm. That's part of the brachial pulse. Right. So here's a muscle that starts around the brachial part, midway of the anterior arm, and crosses the elbow in front. Guys, the brachioradialis is a boss. It is a powerhouse. Practically much stronger in terms of influencing elbow flexion than the biceps right now. The reason it doesn't get a lot of love, it's covered up by the biceps pretty high, right? So think soleus and gastroc. So the soleus is deep, gastroc's on top. Soleus never gets any love and never gets any, even though it has an important role. Also important to these elbow radial ulnar joint muscles is which distal bones do they pull on? What I mean by that is, we know that in open chain, the radius rotates about the ulna. Okay? So if a muscle pulls on the radius, it's going to have pronation or supination influence. But if the muscle pulls on the ulna, it won't. Does that make sense? In other words, like when you're pulling on the radius, it's like pulling on someone that has skates and they might roll. But when you're pulling on the ulna doesn't rotate about the humerus. So it's just going to be a flexion pull. So the brachialis crossing the elbow in the front and pulling on that ulna tells us that it's not going to try to wrap or unwrap the radius. Exactly. It's not going to have a pronation or supination. Oh, it's just not pulling on the radius. Yes, sir. So, pulling on. So, I haven't seen you very bad. I haven't heard about the region of this. Okay, yeah. What's the question? We're gonna get, that's a really good question. You don't have enough information yet. I'm gonna give you that information to really show you why having a different radial positions isolate different muscles. And it's called neurological insufficiency. And it's something I'm going to give you at the end once you have chess players in the elbow flexion, pronation, supination game. But you're right, it does have something to do with the fact that there's certain muscles that are pulling at both the elbow and the radial. Good intuition. Very good intuition. So the brachialis is deep, just like the soleus is deep. And on top of it is our biceps brachii. Okay? So our biceps, two-headed muscle of the brachial part, We have a long head and a short head. That's going to come into play when we do shoulder stuff. But both heads cross the elbow in the front. Now this is a little bit of an illusion. The part that's in this picture medial, this is just fascia. So in other words, that's not tendon. Remember when we did on the lower extremity, I showed you the gluteus maximus, and it looked like the gluteus maximus blended into the IT band, to the iliotibial band. But that was just fascia, proprioceptive stuff, making sure we know where different bones and different things are based off of the real tendon, the actual rope that's pulling, crosses the elbow and is pulling on the radius. And so right away, you should be like, oh, pulling on the radius, there's going to be some type of wrap or unwrap type of thing, right? This is true teaching right here, because this is where it gets a little crazy. There's a little style, like styloids, tubercles, all that means is just bony prominences that over the course of time, those bones, those muscles are tugging and your body will lay down more bone where and it'll serve as an extra leverage pull. So you see this little blue spot right there on the radius? That's where your biceps brachii inserts. Okay. In anatomical position, you are already supinated. Can't go any further. It's a firm endpoint. So in anatomical position, the bicep is pulling on that radius, but the radius can't spin anymore out. However, think of this, that little blue spot, that's where the biceps brachii is pulling on the radius. When I pronate, do you see how now that muscle would want to unwrap the radius? You see that? Muscles can only pull. You see that? So the biceps brachii is an elbow flexor and a radial ulna joint supinator. Also functions at the shoulder. We'll get to the shoulder. Okay. So think about a functional task, opening up a bottle of wine, starting a lawnmower, where you would kind of have this kind of supination pull with elbow motion. See if I can give you one more analogy in case it's not sticking. So the biceps brachii, you see how pulling the little tubercle right there, right? Little biceps tuberosity. You'd be trying to unwrap the radial ulna. Ooh, here's a good one. Humor. Flex your elbow. Put your left or right hand on the meaty part of your anterior arm, and then pronate and supinate and feel that muscle shorten and lengthen. You feel it shorten and lengthen? Okay. When you pronate, it gets longer because it's being stretched at the radial ulna joint. When you supinate, it gets shorter because it's being shortened at the radial ulna joint. You're not moving the elbow. You feel that? Okay. So that's showing you lengthen when I pronate, shorten, unwrapping when I supinate. I think I had a picture of this. Ah, look at that. I got you back. So it's being spiraled around when you pronate. It's unwrapping when you supinate. Feel it? Biceps brachii, elbow flexor, radial ulnar joint supinated. All right, let's get to the brachioradialis. This muscle is called the midway muscle. Check this out, guys. In a semi-prone position, the brachioradialis, brachial part of the humerus, to the radial stylon. I'm putting the TheraBand on my thumb as a reference, but it's pulling on the radial stylon, so it doesn't cross my wrist. But the pull is similar in terms of vision. So what I want you to see is, in a semi-prone position, there is no obliqueness to that muscle. So just running straight from the brachial part of my arm to my thumb. From anatomical position, not anatomical, from a semi-prone position, if I supinate, now I give it obliqueness. I give it a second pull. I give it a transverse pull. I make it an oblique. If I pronate from midway, I also give it the same obliquity, just in the other direction. The midway muscle wants to pull transversely to midway, to semi-prone, to here. I'm not talking about elbow flexion. It's always an elbow flexion pull. I'm talking about radial ulnar joint wise. So what I like to do in 20 years of teaching is we're going to separate radial ulnar joint motion into two quadrants. Quadrant 1 is from anatomical to midway, semi-prone, and quadrant 2 is midway to fully prone. Quadrant 1, quadrant 2. So far, so bad? Anatomical position starts us in quadrant 1. In anatomical position, the brachioradialis is a pronation puller because it could pull me, but only to midway. So that's why on your circle, your brachioradialis is listed as a pronator. Brachioradialis, elbow flexor pronator. Because anatomical position, you're in quadrant 1. You're supinated, so it's going to be a pronation pull.
So this is all done with other muscles, or there's not significant?
Just that. Yeah, well, there are other muscle examples that I've hinted at that I just haven't held you accountable for, maybe in grad school, because I tried to do it in the past and it was just too much. Like your rectus abdominis in anatomical, there's no obliquity to it. But if I twist to the right, it would want to pull me back to midway. And if I twist to the left, it would want to pull me back to midway. So it can be a left transverse puller or a right transverse puller, depending on my position.
Okay, so you're calling a pronator on there because like if you're supinating, it's trying to pull you.
So the reason it's listed as a pronator on our circle is because we're in anatomical position, which means it has obliquity in anatomical position. If anatomical position was here, like our trunk, and it was a rectus, it wouldn't have any transverse pull. So in quadrant 1, the brachioradialis is a pronator. It's a pronation pull. In quadrant 2, the brachioradialis is a supinator. It's a supination pull.
So the circle shows quadrant 2.
No, the circle shows in quadrant 1.
So why? I'm not understanding what the error numbers.
It's all good. This is teaching and learning. We're going to be patient. This is weird. I set the precedent that we have certain muscles that can switch their function depending on your joint position. Not all of them, but we do have some. And I hinted at it, and now I'm going to hold you accountable for the first one, okay? So these circles are referenced to anatomical position, okay? In anatomical position, my radial ulnar joint is supinated, which means it's in quadrant 1. Quadrant 1 is fully supinated to semi-prone. Quadrant 2 is semi-prone to fully prone. I've said this before, but you ever wondered, I think we did this in 310, the reason this is called semi-prone and not semi-supine is because anatomical position is supine and you have to have pronation to get there. If anatomical position was here, this would be called semi-supinated position because you'd have to supinate to get there. So that's why it's called semi-prone, because you have to travel down the pronation road to get there, okay? So the reason it's a pronation puller is because all of our circles are in anatomical position. And the brachioradialis is a pronator in anatomical position. But it can be a supinator if we go past semi-prone into fully prone land. If you want to fold this. It's different, but it's very similar to, let's say I put this TheraBand onto this PVC pipe and muscles can only pull, right? So let's say this was pronation pull and this was supination pull. Well, when I'm in here, the TheraBand is pulling in a direction of pronation. But as soon as I get to semi-prone, but it's just straight, it's just trying to pull it up. It's not trying to twist it and pull it across. But if I tip it this way, now it's trying to pull me back. So it's just trying to pull me transversely here. And if I'm on this side, it's a pronation pull. And if I'm on this side, it's a supination. Before we get into some applicable examples, because they will get confusing, but I'm here to try to work that out. Do we at least understand the concept of, in quadrant 1, it pulls in a direction of pronation, and in quadrant 2, it's pulling in a direction of supination. At the end of the day, it's trying to pull you into a semi-prone position. It gets longer when I do this, and it gets longer when I do that. It's trying to shorten, trying to shorten. Obliques, obliques. Okay? All right. Now's where it gets fun. To determine, and I'm going to test you on this, I'm telling you, there are going to be some all the time pronators, and there are going to be the brachioradialis, which is a part-time pronator or supinator. In other words, it depends. It depends on what position you're in. If you need pronators, if you identify you need pronators, the group, and you're in quadrant 1, the brachioradialis is like, I got your back, I can help. Because it is a pronator in quadrant 1. If you need supinators and you're in quadrant 2, the brachioradialis is like, I got your back, I can help. Because I can be a supination puller in quadrant 2. So now let's think of what the opposite of that would be. If I need supinators in quadrant 1, the brachioradialis can't push me into supination. So if I need supinators in quadrant 1, brachioradialis is like, sorry, I don't pull like that. I don't pull that way. And if I need pronators in quadrant 2, brachioradialis is like, I'm sorry, I don't pull that way. Does that make sense? After you finish writing, I want to show you something. Agonist, trying to supinate, external force trying to supinate me. I need pronators. I'm going to have some all the time pronators. And then I'm going to ask myself, can the brachioradialis help them? In this position right here, brachioradialis can be a pronator. Pronation with pronators, brachioradialis, concentric, 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 concentric. Brachioradialis is like, dude, I can't pull you across anymore. For semi-prone, all I can do is flexion pull. However, once I tip it over, gravity is now trying to pronate me. I need supinators. True? I need gravity's trying to do this. Don't I need muscles that are pulling like this? And I'm in quadrant 2. So the brachioradialis is like, dude, I can help with this. Supinators with the brachioradialis. So this is what I'm trying to show you. Guys, there's no rules that said human movement has to be easy. A lot of it's easy, but a lot of it takes work. Brachioradialis would be working as a pronator through concentric work to get me up, and then all of a sudden he changes his allegiance and he's working as a supinator through eccentric contraction to lower me down. Concentric as a supinator to bring me up, eccentric as a pronator to lower me down. Concentric as a pronator to bring me up, eccentric as a supinator to lower me down. In this example, does that make any kind of sense? Awesome. Awesome. The easiest way to me to see it is to chop it up into parts. First is to learn the brachioradialis is a pronator in quadrant 1 and a supinator in quadrant 2. So it makes sense. If I need pronators and I'm in quadrant 1, yes. And if I need supinators in quadrant 2, yes. However, if I need supinators in quadrant 1, no. And if I need pronators in quadrant 2, no. So in other words, if I was doing manual resistance here, and I said, don't let me push the pipe up, well, the external force is trying to supinate me, I would need pronators. The brachioradialis cannot be a pronator in quadrant 2. If I'm doing a manual resistance and the external force is trying to pronate me, so therefore I need supinators. The brachioradialis cannot be a supinator in quadrant 1. You get the hang of it. Let's go to, before we get into the pronators and supinators, because those are real pieces, let's go to the curl exam that I'd already been talking about. Something I've said in 310 before, pure rotation is a heck of a lot easier to create than general motion. General motion has linear work to it. Meaning, I can take 100-pound dumbbells and do this with them, but I can't do this with them. That's what I'm trying to say. Flexion and extension with 100-pound dumbbells, not going to happen. Internal and external rotation with 100-pound dumbbells, assuming I can grip. It does not take as much force to pronate and supinate as it does to flex and extend, is what I'm trying to get to. 50-pound dumbbells, a heck of a lot harder to do this than for me to do this. So far, so bad? All right. So now let's imagine I have a dumbbell. And I already taught you about limb tension of muscles in our lower extremity, very important. But in our upper extremity, instead of like brute force and power to move our bodies up and to run and to jump, we have a lot more neural things happening up here for dexterity purposes and to write and to work and to do. There's a lot more neural issues happening here. Imagine if I had a dumbbell, or not even a dumbbell, just a ball, very light. And I said, what muscles am I using at my elbow to hold this position? Say your elbow flexors. Who are the elbow flexors? Brachialis, brachioradialis, biceps brachii. Your biceps brachii is a flexor of the elbow, but it's also a supinator in the radial joint. So if the biceps brachii pulls too much, in other words, it's trying to do this to me. And if I don't want that, then I need to tell the biceps break guy, hey bro, settle down a little bit. Because I know you can help, but you want to do this and this. Because the muscles don't know any better. The muscles are just pulling. The biceps break guy wants to do this and this. Does that make sense? In this position, in a semi-prone position though, I have two muscles that are elbow flexion pullers that are not trying to do this. My brachialis, which is yanking on the ulna, and my brachioradialis, which is in a semi-prone position. So in other words, why does a hammer curl emphasize not just the brachioradialis, but the brachialis? It's because neurologically, I'm going to choose not to recruit the big bad biceps breakout. I'm going to purposefully not innervate the biceps breakout because I don't want to have this secondary radial ulnar joint function. Does that make sense? So I'm going to recruit other flexors who are not trying to pronate me or supinate me in that position. Thus the brachioradialis, thus the brachial. That's why this position emphasizes those muscles more. It's not about length tension. It's about literally not recruiting one of my powerhouses because I don't want to have a secondary function that it can easily cause in the transverse plane.
This is just, I've always found that like you're higher weight with the hammer curl versus the strict curls, and it seems like strict curls you should be able to do it heavier.
There's a lot of factors. So let's talk about some of those factors. When you are fully supine, some of the things that happens is your shoulder position changes, like when you do fully prone, sometimes your elbow goes out, sometimes your elbow comes in. But in addition, when you're fully supine, your brachioradialis now is a pronation puller, right? So now in a fully supine position, your brachioradialis is out. In addition, in a fully supine position, your biceps brachii is on slack at the radial ulnar joint. So sometimes that can have an effect. Is that your biceps brachii is short? So there's limb tension issues that we had talked about in the lower extremity. And then there's also mechanical issues that can happen, like with your elbows and being here or being there. So those are some of those issues, because I think some people do feel more comfortable in a fully supinated position because your biceps brachii, although it's in a short position, you can innervate it as much as you want, and it doesn't have to worry about a secondary, it doesn't have to worry about spitting out because it's already at the end, it's already at its firm endpoint. So you can yank on it as much as you want, and you won't have to worry about this because it's already there. So I guess that could just be preference. But the key thing, though, is that if we're looking at isolating specific elbow flexors, radial ulnar joint position has an effect. If you're fully prone, 2 of your 3 elbow flexors are supinators. If you're fully prone, your biceps brachii is a supinator and your brachioradialis. So that's why like a fully prone curl would emphasize your brachialis to have to do more of that because it's just yanking on the ulna. But being in a fully prone position, one of your limiting factors is now your finger flex, right? So it's the sum total of all these different issues. But there's issues nonetheless because those elbow flexors have radial ulnar joint influence, whether directly biceps brachii, brachioradialis pulling on the radius, or indirectly your brachialis yanking on the ulna. Are there specific, when you do curls, do you do with specific exercises? Because that sometimes matters too. Like, what I mean by that is if you were doing dumbbells, obviously I can independently pronate and supinate them. But if I have a barbell, I can't, right? Like I'm not going to snap the bar in two. So actually a barbell would recruit more of your biceps brachii because the bar itself is neutralizing the supination torque of the bicep, so that way it can yank more and not have to worry about the supination.
I usually use the dumbbells, so that might be part of it, because I have to hold it in a position as opposed to select.
Outstanding, outstanding, very good, very good. So, and again, it's not that there's not exceptions to the rules, you know, there's always outliers. But maybe you could try it out with a barbell just to see if there's any transfer, knowing that the bar itself is gonna neutralize that.
With the regular block. It's rather than the other way, it's block their own thing.
Yeah. And that's why they have like, those modifiers where like you can kind of come at an angle, right, to try to make it more semi-prone, but you still have the bar preventing unwanted regular joint motion. That's why you have that, is because these muscles that are influencing elbow flexion by pulling that way have direct and indirect radial joint function. And that's what we call neutralizing. Like you have, just like you could have certain muscles neutralize unwanted motion, you could have equipment that neutralize. That's what we call closing chains. You know? That's what we call closing chains. But I just, for the purposes of this test, I need you to know that in anatomical position, the brachioradialis is pronate. But between midway and fully prone, it's a supinate. I want you to know that in a fully, I'm going to give you very specific curl exercises with a dumbbell on purpose. The dumbbell will be used on purpose so that we don't have the bar neutralizing radial motion. Okay? So it would be like, not bar, sorry. That was dumb. Get it? So let's do. So again, what I want you to be able to see is in this dumbbell curl, her brachioradialis can be recruited as much as she wants, and you don't have to worry about unwanted spinning of wheels. Her brachialis can pull as much as you want if it's on the whole now, but the biceps brachii has to limit how much it's pulling. In fact, I'm not going to ask you this on the test, but as you get into grad school, the amount of recruitment that the bicep is doing here is only what can be matched by our other pronators. If that makes sense, because the bicep's trying to supinate you. So my pronator teres and my pronator quadratus actually need to kick on to neutralize the biceps brachii supination pull. For those pronators. And that's when we talk about muscles working in this class, primarily it's as motion influencers. But we do have other functions like neutralizers. Like in other words, if I want my gluteus maximus to help as an extender, but it's also trying to externally rotate me, and I don't want external rotation, I need to recruit some internal rotators to neutralize that unwanted extra effect that the gluteus maximus is trying, just as an example. So this is me introducing you to the concept of neutralizers, and also that a muscle's influence is less than what it could be, not because of length issues, but literal recruitment issues. We're choosing to not recruit the bicep as much as we can because we don't want this secondary function to happen. If we're trying to stay in a semi-prone position, and that bicep, it doesn't take a lot to spin the wheels out. So that's why these different positions emphasize other muscles, is because of the secondary functions of the radial. So for the test, it would be very specific to dumbbells, and it would be Biceps brachii here, because it doesn't have to worry about supination because you're already supinated. It can pull as much as it wants. Here, brachioradialis, and here, brachialis. The reason, now again, brachialis is working all the time, but the reason the brachialis work more is because two of its helpers are supinators under fluid prone. So let's find a picture of dumbbell curl. Okay, so let's say this girl, what do you know need? Let me see if I can find a coordinate. There we go. Well, that's not bad. At least he's in the position I want for this conversation. So what I'm trying to get at is, with these dumbbells, three elbow flexors, three main elbow flexors, brachialis, brachioradialis, biceps. In this pronated position, two of those three are also trying to supinate you while they're trying to flex you. Two out of the three are elbow flexor radial ulnar joint supinators. So if you don't want to have supination and you're trying to stay prone, you're going to suppress how much you recruit those muscles as agonists. You literally won't recruit them as much if you don't want this secondary function to happen. If you don't want to do this, if you want to stay here, you have to recruit them less because it doesn't take a lot of force to do this. So if you're suppressing two of the three, guess what? The third one, who has no radial ulnar joint function at all, gets to be emphasized more, gets to be recruited more. So that's why a fully prone position really emphasizes the brachialis, because it doesn't have to worry about unwanted radial ulnar joint motion. That would be the extent of my questions. It's like, which of my elbow flexors would be emphasized at the elbow because of the radial ulnar joint position? And again, in a fully pronated position, your brachioradialis and your biceps brachii are supinators. And so you would lessen their recruitment. Really, you would only recruit them as much as what you can neutralize from your pronators. And the brachialis is like, ooh, this is my time to shine because I can recruit all I want and I don't have to worry about radial ulnar joint motion. I'm just yank on that elbow. Does that make sense? Semi-prone position. In a semi-prone position, fully semi-prone, I see. So in this position, only my biceps brachii is an elbow flexor supinated. In a semi-prone position, now my brachioradialis is like, finally, I don't have to worry about some unwanted secondary radial ulnar joint function. I can recruit as much as I want. There's nothing that has to neutralize a radial ulnar joint motion. And so think about it. If the brachioradialis can pull more, brachialis is like, sweet, I got some help. I don't have to pull as much. Make sense? So that's why this one would work more. Not all, but it would work more brachioradialis because the brachioradialis doesn't have to be neutralized by me. Well, okay, we analyze motion joint by joint, we analyze muscles joint by joint. So in terms of the wrist muscles in a semi-prone position, gravity would be trying to ulnar deviate you. So you would need radial deviators to maintain this rigid link here, right? Your flexor carpi radialis, your extensor carpi radialis would be working isometrically to hold this. No, because it doesn't cross the wrist. I don't know if I didn't do a good job of explaining it, I apologize. I used this on my thumb as an example, but the brachioradialis goes to the radiostyle. It was not cross the wrist. So goes to there. Does not cross into the wrist. So in other words, when we did the wrist circle, you did not have brachioradialis anywhere on that wrist circle. For my athletic trainers or my therapists, I don't think I have any more athletic trainers in here. There's a brachioradialis reflex test, and you're looking for the thumb motion, but it's not because the muscle crosses the thumb, it's inertia. So in other words, you do the reflex, it flexes your elbow and you see the whip of the towel, if that makes sense. So sometimes that can be confusing for people looking for the thumb, but it's not actually doing this. It's just when it flexes the elbow, you get a whipping action of inertia with this. We're cool? All right, on Wednesday, we'll go through the rest of the muscles. These are the hardest ones. The elbow extensors are all ulna pulling, so there's no radial ulnar joint motion of our triceps, brachii, and our incronius. And then we have some little sharpshooters, ones that are only pronation or supination pullers that don't have any extra elbow stuff. So this was the hardest stuff today, and the rest should be easy. And then we'll do a lot of practice. We'll do a lot of examples, because I'm telling you guys, the brachioradialis stuff, students struggle with it. But I think it's just because we don't do enough practice. So we'll do more practice and make sure we don't struggle with it.